We're going to do an overview of the skeletal tissues. These are the microscopic anatomy of the bones. We'll also cover the functions of the bones, formation of bones from the embryo to full development. We'll cover the gross anatomy of a long bone, and I'll pretty much cover that. So the skeletal system consists of connective tissues, and these include bone, cartilage, and ligaments. And if you'll remember, this is connective tissue proper. It's like dense, irregular connective tissue. Bone development, of course, begins in the embryo in a model. The mass of cells, that is your body as it develops, starts differentiating, and there's a gel-like mass, and within that mass, chondrocytes, which are cartilage-producing cells, begin to make a model of your bones. So they're not hard bones like the bones you have now. It's more like a bendable cartilage. Then we're going to look at mature bones as it goes all the way through growing up, and then how it remodels and how it repairs. Again, the functions, and then we're going to touch on joints, ligaments, and disorders. So the connective tissues, of course, are bone. These are the hard elements of the skeleton, and this is called osseous. Trying to get this straight. Osseous. And we have osteoblasts, which are the bone forming cells. And then we have osteocytes. O-S-T-E-O. Still haven't learned how to write on this very well. These are cells that maintain bone. And then we have osteoclasts. Class, and these break bone down. These build bone, and these maintain bone. Then ligaments, this is dense fibrous connective tissue. Right. I changed colors here. Oops. So then we have ligaments, which are, again, dense fibrous connective tissue. Remember? Oh, where's my pen? Okay, and these attach bones to bones. So what you need to remember is that ligaments attach bones to bones, and tendons attach bones to muscles. It's a good test question. People forget that. So you just have to make that distinction. And then cartilage. This is specialized connective tissue. Remember, it's one of those special connective tissues. It has elastic fibers, collagen fibers, and of course ground substance and cells. So I always ask myself, which problems, does any system solve for a colony of 70 trillion cells? So one of the problems is, how do we move around? So we have to have some structures in place which allow us to move, around the planet, right? We have to go and hunt for our food. We have to plant our food. We have to, run errands, things like that. So we use the body very cleverly designed bones and muscles. And at the same time, because these structures solve more than one problem, this is support for organs. All those organs in your abdominal cavity, they're suspended by ligaments, and those ligaments are attached to structures which are attached to bones. So it suspends all of those internal organs, and without that, well, you can't even imagine. We would just look like a giant blob of protoplasm on the ground. So it serves a grand purpose, and it makes us look real pretty too. So protection of organs and brains, that's obvious. A brain is just a bony helmet, and the organs, look about the heart and the lungs, they have a whole cage around them for protection. Movement, to hunt and gather, wink wink, and it provides levers for muscles. Okay, that's how we move around. In the middle of long bones, there are cavities where baby blood cells are forming. So that's red blood cells and white blood cells. It's in the medullary cavity, which we'll cover in a moment. And then there's mineral storage. Mineral storage is where the calcium and phosphate obviously are what make your bones hard. And when your body gets too acidic, it can steal some calcium from your bones to make your body more homeostatically in the good pH range, but it can also leach calcium from your bones and cause osteoporosis. So that's a little bit of a tricky thing there. So let's begin in the fetus. I love this picture. You can see here's the humerus, the radius, the ulna. You see the little metacarpals metacarpals here and the phalanges out here. These are all hyaline cartilage, and if you'll notice, the whole outline of the fetus is already set in stone here. The body will grow into the size of the head, and there are other cartilages which will extend from these ribs, which will extend from these ends. He's not, fully formed yet, but you can see his tibia here and his fibula here. He's got most of his bones in place. There's a little hip. So chondroblasts are the cartilage forming cells, chondroblasts. Chondrocytes are the cartilage maintaining cells. The skull is composed of a fibrous connective tissue. It is not cartilage. It's a fibrous connective tissue because those are flat bones. So they ossify in a different way. This is called, when they ossify, this is intramembranous. Because fibrous connective tissue is a membrane, sorry, and not a cartilage. So you have to remember the difference between intramembranous ossification and then long bone endochondral ossification. So later fetal development, osteoblasts replace cartilage with bone. That's just ossification. And then in childhood, we have primary and secondary ossification sites, so that the shaft can ossify, and that in the meantime the bone can still lengthen. And in adolescence, we get further elongation of the growth plates, and in men this goes on till about 25 years old. So in pre-adolescence, this is before puberty, growth hormone stimulates all of the bone lengthening, and at that time, during puberty, estrogen and testosterone start to course through the body, and they stimulate the lengthening of the bones. And then in late adolescence, estrogen and testosterone again cause replacement of the cartilage growth plates with bone. So we do have a remnant of our growth plates, but they don't grow anymore as adults. So again, we have intramembranous ossification in the skull and the clavicles, and endochondral ossification. It replaces hyaline cartilage in the long and the irregular bones at the epiphyseal plates. Remember that ossification means ossify. That means hardening. So it turns that cartilage into bone. And that's the whole point. That's how we get our bones. So here's just a little schematic of how this kind of happens. In the fetus, you have just chondroblasts are making a rudimentary model a model of the future bone. And then here we have this perforating artery that comes in because now we need to begin our primary ossification center in the middle here. So these cells need nutrients. So this nutrient artery, it's called an actual nutrient artery, comes in here and feeds these cells, and then we have these periosteum, which is the lining of the bone. Okay. The periosteum, by the way, is very well neuralized, so when you break a bone, it's really the periosteum that gives you all the pain. And the periosteum is just like a sheet of saran wrap that you wrap around a bone. It's a very thin sheet of tissue. So then, in childhood, we have, again, now look, see this arterial network has gone all the way up to the growth plate, which is here and here. So this is our secondary growth plate up here. This will be the epiphyseal plate right here. Epiphyseal plate. The chondroblasts are secreting osteoid, which is bone-like material. Osteoid. And then enzymes are facilitating the deposition of hard hydroxyapatite crystals. These are the crystals that are going to make the bone hard. So on a long bone like this, we have compact bone, which is on the outside. Can't even. You can see where this arrow is. And then you have on the inside, see all this? It looks like there's a lot of air pockets. This is called spongy bone or trabecular bone. Okay. So at the growth plate here, here's the growth plate. This is also the epiphyseal plate. Let me spell that for you. Epiphyseal plate. And when an adult gets an x-ray, you can see a little density here. Okay? So at the end of long bones, you have a joint. This is hyaline cartilage. So that where it forms a joint with the next bone, right? These cells can mitigate some of the pressure from the joint. It's a little bit soft, so you can have pressure. These cells will regenerate better than bone will. It's a little bit cushiony, and it's very, very slick, which bone is not. So it makes a much better articular surface. So again, as we go on, the chondroblasts deposit new cartilage at the outer surface. So this is cartilage out here, and this is ossifying. And now we have our epiphyseal plate right here. So that's kind of a permanent structure, sort of a scar. So intramembranous ossification. So we have these flat bones of the skull. Just take one like this. Okay, like the frontal bone. So it's flat. It's like 1/4 of an inch thick. So this is just fibrous tissue here. You can see a fibrocyte right here and collagen fibers. Well, a osteoblast will begin multiplying here, and it will deposit this osteoid, right? Osteoid. And it will form bone tissue, and then it grows from the outside. This will make osteoid here, and another cell will be here, osteoid cell, and in this way it makes bone matrix within that fibrous membrane, and that's that. It's pretty simple. Okay, so here's a gross picture of a long bone. The ends of bones we call epiphyses. Okay. The proximal and distal ends are both epiphyses. The center portion is called a diaphysis. It means between the ends. And then in the middle, so again, this is compact bone around the edges of the bone, and in the middle is spongy bone. And this is the medullary cavity. And this is where blood cells grow. Okay, you can see the trabeculae here. This is a network of supporting structures, and the way that they form depends on how much pressure and the kind of pressure that you put on this bone. So your hip is going to be up here, right? And depending on what kind of sport you do, what kind of activity you do, it places different stresses on this is the femur, on this bone. And so this network of bony structures will remodel to be able to support that activity. And the more you exercise, the denser these bones will get. And the less you exercise, the less dense they'll get. In fact, astronauts who come back from a week in space lose about 25% of their bone mass. So they have to take care of that pretty quickly. So here's that thin sheet of connective tissue that surrounds the bone. Okay. Okay. So if we take a little chunk of this bone out and we put it over here, again, here's this periosteum, right? And we have this structure here called an osteon. This is a primary unit of bone structure. And here it is on a real picture. Here's the osteon, right? So it has this central canal. Every osteon has a central canal right there. And this is an osteon. This is a central canal of an osteon. This is the central canal of an osteon. This is the central canal of an osteon. And this is the central canal of an osteon. So there are many, 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 many of them. Then we have, the next thing is the lamella. And these are concentric circles which surround the central canal. Okay, you can see the circles. You can see the circles up here. These are like sheets that have been molded into a circle. So if it was a sheet like this, then you fold it, right? I don't even know how to draw this. And you fold it into a circle, like a roll of toilet paper, okay? But this sheet has osteoblasts in it, okay? So as it rolls up, now we have these osteoblasts here. So this inner lamella, you know, you have a vein and an artery coming out. So these osteoblasts receive their nutrition from this vein and artery here. The vein takes the waste away, and the artery brings the nutrients to these cells through a canal called a canalicula. This canal will go right into the central canal. Okay, so it gets fed directly from that. Now, each of these osteoblasts has a surrounding covering, we'll say, okay, and that's called a lacuna. So the osteocyte, the osteoblast grows into an osteocyte, is surrounded by a lacuna, and it has these extensions called canaliculi. Canalicula is singular, canaliculi is plural. And these connect to the central canal if it's in the first ring, or it connects to the second ring if it's here. The canaliculi connects to the next osteocyte. Okay, so it will be feeding the next guy, if that makes sense. And this one will be feeding this guy through the canalicula. They're little canals. Okay, so these are haversian canals. These central canals are also called haversian canals, in case you see it on an exam. Haversian, central, same thing. Same thing. The perpendicular canals, okay, which are penetrating canals so that they can go to the medullary cavity, because the spongy bone is different. It gets its nutrition directly from the veins and arteries. The yellow one, by the way, is a nerve. This is called a Volkmann's canal. Volkmann's canal is perpendicular to the Haversian canal. And that's how bone is structured. It's that simple. So the chemical composition and the cells of bone. So we have these three bone types. The osteoblasts are the bone-forming cells. The osteocytes are the mature bone cells. The osteoclasts are large cells that resorb or break down bone matrix. They actually secrete hydrochloric acid, which obviously just dissolves all of those calcium salts. And then osteoid is an unmineralized bone matrix composed of proteoglycans, glycoproteins, and collagen. The proteoglycans and glycoproteins, you don't have to remember those names. That's what makes the matrix. That's what makes the matrix on many of your connective tissues. So the inorganic molecules are hydroxyapatites. I'd like you to remember that. And these are just mineral salts, mostly calcium and phosphorus. It's 65% of the bone by mass, and it's mainly calcium phosphates, and they're responsible for the hardness of your bones and its resistance to compression. However, remember, there's also a lot of collagen in your bone, and there is some bending that happens in your bones. So if the stress that you place upon your bones is slow and gradual, your bones will bend a little bit. But if it's sudden, then they'll just break. If you run into a tree on your skis, they're just going to break. Okay, so homeostasis of bone tissue has to do with several different things. It's hormonal, yes, but also your overall physiology. Because if you're too acidic, then that's going to cause osteoporosis. So your overall health or physiology is going to have something to do with your bone homeostasis. And also, I would say the stresses that you put on your bones, what you ask of your bones. So stress on bones. Okay, if you take up high jumping and you put a lot of stress on your bones and you don't eat any calcium, then they're not going to get stronger and denser like they're supposed to. So we have these two hormones. One is parathyroid hormone, and these come from the parathyroid glands, and the parathyroid glands are on the back side of this gland in your neck called the thyroid. So on the back side you have these four little pea-sized glands, and those are the parathyroid glands, and they're responsible for stimulating osteoclastic activity. So this reduces your bone mass, and it has to have a signal to do this from the brain, so the brain thinks that it's solving a problem. Okay, and then calcitonin stimulates osteoblasts to add calcium. So also it has to have a signal, because these are hormones, and hormones don't act alone. They act from a signal from either the central nervous system or a peripheral nervous system. Okay? That might be a little bit difficult to understand, but just read it over a few times. So what we're trying to do is create a balance in your bones where they have enough density to support your activities, but not too much so that they're too dense, because bones always want to stay as light as possible so that it takes less energy to move you around. Your body tries to be very energy efficient. So bones remodel all the time, and they remodel to keep the bones fresh and to keep them current with what your current activity level is. So this is a natural process that you want in your body, and it keeps your bones very healthy. So we have changes in shape Those are very small changes, very small changes in size and strength. And some of the things that change these are diet, exercise, and age. Weight-bearing exercise increases overall bone mass and strength, and bed rest does the opposite. So the more you sit and watch TV or work on your iPad, the less bone mass you will have. So students typically have low bone mass because they're reading all the time or studying all the time, sitting in a chair. It doesn't build bone mass. So bone homeostasis depends upon this very delicate balance of osteoblasts, which break it down, and build it up, and osteoclastic activity. So it's like this. If I can, here we are. So they always talk about homeostasis as like a teeter-totter, right? So if one side goes up, the other side goes down. So osteoblasts, right, take it down, and sorry, I keep doing that. Sorry, that's wrong. Let's go to the eraser. Erase that, and erase that, and go back. Here, sorry. Osteoblasts increase bone density, and osteoclasts reduce bone density. Okay? So remodeling units, these are adjacent, meaning they're next to each other. Osteoblasts and osteoclasts deposit and resorb bone at periosteal and endosteal surfaces. And I have a pretty cool video on this, I think, that I put it up already. It's very, very cool. And then osteoporosis is loss of bone mass due to prolonged imbalance of osteoblast and osteoclast activity, which happens with age, and you have to make special efforts to build bone. There are many, many ways to do this. I'll just give you an idea that osteoporosis, I've treated many people with osteoporosis, and it's a very debilitating and painful disorder. So it's not really something you want to entertain when you're old. So this is just a quick diagram. If you'll notice, if you have a compressive force, let's say you're lifting a 200-pound weight, notice how the shaft of the bone is sort of bending. It can bend for a little while, and then it'll break. But the compressive force will stimulate this bone to get thicker. And if you notice, this bone is now thicker because new bone was added here. That's just a brief overview of how that works. Okay, so again, I'm going to talk about the structure of long bones because you'll definitely be tested on this. This is a humerus. This is the proximal, that means closest to the axial skeleton, epiphysis. Epi means on top. Here's the diaphysis, it just means the whole shaft of the bone. And this is the distal, or farther away from the axial skeleton, epiphysis. Here's your compact bone, this dense stuff right here. That's compact bone. Periosteum is very, very thin. And here's your medullary cavity. And it stores fat, and it's the cradle for forming red and white blood cells. This is all spongy bone in here. So the spongy bone looks like this, and it's got a lot of blood vessels in it. If you break a bone, it's going to bleed a lot. And here around the joint surface is the articular, meaning joint surface, cartilage. And then the spongy bone has the spongy on the inside, and then as it gets towards the outside of the bone, the periphery of the bone, you have the compact bone. And then here's the articular cartilage, because we took this chunk right out of here. If we took a chunk down here, it would not have articular cartilage on it. So here's the yellow bone marrow. We have yellow and red bone marrow. The lining of the medullary cavity, this tissue here, is called endosteum, right? And what is this one here on the outside? called peri. Peri means around. Where's my... Where are you? There you are. Periosteum. And then you have these what are called perforating or Sharpie's fibers. And that's they're actually little tiny ligaments that attach the periosteum to the bone. The periosteum is enormously important because it has all the nerve fibers. Even though there are nerves inside the bone, these are the ones that are going to tell you when you hit your shin or you hit your elbow. They cause a lot of pain, and hopefully you will retract from that situation and not cause further damage. And also this is where a lot of bone growth happens. And then the arteries that go into bones, they're all called nutrient arteries. So let's go on to cartilages. There are three types: fibrocartilage, hyaline cartilage, and elastic cartilage. And they'll serve different functions. The fibrocartilage, I want you to know where these exist in the body. Fibrocartilage, intervertebral disc, and the menisci in your knee joints. A meniscus looks like that. And it sits on top of your tibia so that the head of the the head of the femur, it has a little more stability. Because see these edges here, they come up and they cause more stability. So I want you to know, if I say where would you find fibrocartilage in the body, you would say intervertebral disc and menisci in the knee joints. Then we have hyaline cartilage. And this of course forms your embryonic bone structure, and it covers and protects the ends of the long bones in the joints. Okay, so it's basically in joints, or joint surfaces. Okay, then elastic cartilage. This is the fun one. This is very flexible, and if you just flap your ears, you'll find the elastic cartilage. And then your epiglottis, that covers your windpipe when you swallow. It's a great little visual to see where these cartilages are. So hyaline cartilage is blue, so it's in your nose, right? It's in all these joints, and it's in the what are called costal cartilages. Where's this? So the costal cartilages are all of these, and they connect your ribs to the sternum, and they allow for flexibility when you breathe. Okay, so the pubic symphysis between your pubic bones is fibrocartilage. And what else? Oh, the cartilage in the external ear, elastic. And that's about it. Okay. Ligaments. These attach bone to bone. Don't get it confused with tendons, which attach muscle to bone. These are made of dense fibrous connective tissue, and they provide strength. They are flexible, but they hold the bones together so they don't go flying off. Then we're going to talk about bone shapes a little bit. We have 206 bones in the body, and they, anatomists do what they do. They have to classify everything. So the classifications are long bones, short bones, flat bones, and irregular bones. The irregular bones are the coxal bones, the sacrum, the vertebrae. The flat ones are the cranial bones, the sternum, and the ribs. Although those may look like long bones, they're really considered flat bones. The short ones are the wrist bones in your wrist, and the long ones, I'll never test you on this, but they want you to know that there are bone classifications. And here's a nice picture if you want to look at the picture. Okay. So there are two divisions of the skeleton, the axial skeleton and the appendicular skeleton. The axial skeleton includes the head, okay, the whole head, the whole spinal column, right? The sternum, the ribs, And that's it. Everything else is considered appendicular. So why do they classify it like that? Because anatomists love to classify things. So know what the axial skeleton is and know what the appendicular skeleton is. So then we're going to start on specific bones. Okay, so we start with the skull. And the skull, or the cranium rather, the skull is the cranium and the face, facial bones. So the cranium has 8 bones. The frontal bone, right here, frontal bone, 1. 2 temporal bones. The temporal bones are where your temples are, right? 1 occipital bone in the back. 2 parietal bones up here. 1 sphenoid bone, which you can only see a small portion of. Well, you can feel it, but it goes across inside. If you look down here on this lower picture, the sphenoid bone goes all the way across like this. And 1 ethmoid bone. And the ethmoid bone is right here. And they don't have a picture of it down here. Okay, on the underside of your skull, you have a foramen magnum. This is where your spinal cord will enter. Here's the occipital bone again. Here's your palatine bone. Where's that? Palatine bone right here. This is the maxilla. And this right here is the zygomatic bone. Zygomatic bone. In the face, the facial bones, you have 2 maxilla. This is the maxilla right here. So you have a left and a right side. 2 palatine bones. The palatine bones are here, down here. You have 2 sides, so that makes 2 bones. 2 nasal bones. Nasal bone. They're very tiny. It's just the bridge of your nose, but has a left and a right side, so that's 2. 2 inferior nasal concha. I don't know if they have this on here. They don't have them on here. They're inside the nose. 2 zygomatic bones. 1 here and 1 here. 2 lacrimal bones. Those are these blue ones right here, right and left. 1 vomer bone. They have it here? Yes. The vomer bone is right here. And 1 mandible. This is just 1 bone. Okay. You have a hyoid bone that's in your neck, anterior to your windpipe, superior to your larynx. And then you have the spine. You have 7 cervical vertebrae. You have 12 thoracic vertebrae. You have 5 lumbar vertebrae. 5 fused vertebrae, which make up your sacrum. And between 3 and 6 coccygeal bones, which are the end of your spine. So articulations in the spine, you have the bodies here, right? It's the body of the vertebrae. This is the intervertebral disc. This allows for some flexibility. And if you have a herniated disc, then this will poof out, push out, and it will trap or irritate this nerve that's exiting from the spinal cord or going into the spinal cord. And that's where you get your low back pain. So this is healthy discs up here, and these are this is a herniated disc down here. Okay. The rib cage has 12 pairs of ribs. Okay. This is cartilage. These are the costal, can't tell where I am here, the costal cartilages. Costal, meaning rib. Costal means rib. And they attach to the sternum. And then the floating ribs are down here, and they're the 11 and 12. They're not attached at all. Then you have the clavicle. You can feel it in the front of your body. This is called the pectoral girdle, the clavicle, the scapula. Scapula, and the humerus. This is the humerus here. This is the ulna. This is the radius. These are the carpal bones. We have 8 carpal bones. These are the metacarpals. And these are the phalanges. And we have 14. In the leg, we have the coxal bones. These are the coxal bones here. This is the sacrum here. This is the femur, tibia, patella, fibula, 7 tarsal bones, 5 metatarsal bones, and 14 phalanges. The male and female pelvises look different. The way I tell is this right here, this angle, very angular in the male, and over here it's very gradual. It allows for a wider pelvic inlet to give birth. And this is a joint. This is the knee joint, and all joints have similar properties. They have, of course, that cartilage, the hyaline cartilage on the end of the bone. They have ligaments. Not all joints have internal ligaments. I think only the shoulder has one. These are the anterior and posterior cruciate ligaments, which only occur in the knee. These are the external ligaments. These are lateral and medial collateral ligaments. This is that meniscus we talked about. Okay. This is the fibula. This is the tibia. This is a ligament that goes to the quadricep muscles. And this is the patella, which rides right on this surface right here. Okay, so the muscles of the quadriceps up here all attach to the patella, and that patella inserts on the tibia. So here's the joint capsule. All joints, synovial joints have a joint capsule. That keeps it lubricated. Okay. And then here are the ligaments, which again hold this joint together. And then they want you to know some of these motions. Abduction is moving your arm away from your body or your leg away from your body. Adduction is moving it towards your midline. Rotation is like depicted here. There's rotation. You can rotate your arm and you can rotate it in a larger circle. Oh, this is circumduction. So circumduction is a larger circle. Rotation is on one axis. It's like moving your hand from, so you can show the front of your palm to the back of your palm. That's rotation. Flexion is moving your head forward and back, bending your arm, bending your knee, bending your hip. Okay, and extension is the opposite. So if you move your hand towards your shoulder, that's flexion, and if you move it back out, that's extension. And if you pull your knee up, that's knee flexion, and put it out, that's knee extension. And supination, a special rotational movement over here, is supination and pronation. When your palm is upwards, that's supination, like you're holding a cup of soup. And pronation is when your palm is downward. That's it for now.